Joined by Dr. Ed Colvin, a cardiologist from UAB. How are you, sir?
Very well, thank you. And you?
Doing very well. Thank you so much. Glad that you're with us. We're talking about adult congenital heart disease. Just kind of give us an overview, if you will. What is congenital heart disease?
Okay. Congenital heart disease means a disease with which you are born. So most of the patients that we consider to have congenital heart disease have a structural abnormality in the heart. Often they have holes between the two ventricles or two atria. They may have abnormalities of the valves inside the heart, or abnormalities of the muscle or the rhythm generating part of the heart. But the congenital part means that you're born with it.
Right.
So most of these patients are identified as children, and if they have severe forms of heart disease, they're treated then. But there are many patients now who have grown up.
Yeah, that's kind of, I mean, because of kind of medical advancements, there are more patients are living much longer. Whenever they do become adults, is there a need for specialized care? Yeah,
there is for many of these patients. Currently, there are about 2 million patients in the U.S. with congenital heart disease, and over half of those are over 18 years of age.
Wow.
And many of those patients have minor defects or ones that have resolved on their own over the course of time, but many of them have very severe forms of heart disease that have been treated with multiple operations and catheterizations, and those patients clearly do need a specialized form of long-term follow-up.
What should an adult with congenital heart disease look for in a cardiologist?
Well, adults with severe forms of congenital heart disease are usually followed up in the adult congenital heart program, and the only one in the state is here at UAB. It's grown up as a part of the congenital heart program that began here in the early 60s.
Wow.
And so we have a large number of adult congenital patients at this point. But they also need local providers, and they eventually have problems that are similar to other adults, coronary artery disease and rhythm disorders. So often our patients have two cardiologists. They have a local cardiologist who handles most of their routine care, and they visit with us on a yearly or bi-yearly basis just to keep up with the current knowledge about their congenital heart disease, because that's always changing.
Right. Yeah, UAB, such a gift to the area, do a great job, and you all have provided some really helpful resources. There's a number, it's UAB Health Finder. You can call 1-800-UAB 8816, or there's also a neat website, and Doctor, you're going to enjoy this. It's uabheartbeat.org. You can download a free copy of a UAB Heart Healthy Cookbook, take an online risk assessment developed by UAB cardiologists, and even learn more about congenital heart disease and other heart and vascular conditions, even schedule an appointment with a UAB physician. So again, the number 800-UAB 8816, or head to the website. It is uabheartbeat.org. So UAB has the bases covered. Yeah. Well, thanks so much for being with us, and I appreciate the time.
Enjoyed it very much.
Thank you.
Again, that was a great series from the doctors at UAB about heart health. If you missed any of those, you can always go to our website, daytimealabama.com, to see those and many other videos we do here.
And to give us some feedback, head to Facebook, search Daytime Alabama. You can chat with us there. We also update Twitter frequently. Search Daytime Alabama as well.
Do you like the pumpkins?
Love
and
to hear
the
your
wheat?
thoughts.